of human genetic information and clinical data. It's part of the agency's All of Us program, which aims to speed up health research with the help of user-submitted real-world health data. So joining me now, I have Dr. Anahita Dua, a vascular surgeon who's also a National Institutes of Health researcher and founder and chair for Healthcare for Action. Doctor, welcome back to the show. Thank you for your time.
Thank you for having me.
So this is a huge deal. Talk to us more about this database, what it is and how it works exactly.
Absolutely. This is such a huge deal. I'm so excited to be able to share it. So in 2018, basically this database was created where we said, let's include genetic material of people in conjunction with their healthcare records to actually see what layers are responsible for the diseases that people have. For example, if you have identical twins who have exactly the same DNA, but one goes on to have a heart attack and one doesn't, there's a reason in their environment that one had the heart attack and one didn't. What this database does is it collects data from millions of people overall, where we can look at their genetic material and look at their actual doctor records, what they were exposed to, and figure out why certain diseases are happening and how we can prevent them.
And when people come forward to submit said data, what is that? Is that a blood sample? Is it a saliva test? What all did they submit, and how was the NIH able to just parse through such a monumental amount of information?
So basically it can be the blood sample, it can be saliva, and it's going to be all of your doctor's records. So the genetic sampling comes from the person itself, but then when they sign up for it, they're allowing access to their medical records, what we call longitudinally, which means over time. For example, if I join today and I give you a blood sample today, and maybe I'm going to have a heart attack in 10 years, you need to know that and be able to connect it back. And maybe my doctor's notes and the way that I was showing up in the hospital over the next 10 years was predictive of me having that heart attack.
Yeah.
And that is what we're actually going to target and see.
Okay. It's also fascinating, but I know there is a similar database, right? The UK Biobank that was started more than 2 decades ago. How is this different from that? And are we playing catch up with them at this point? Or do the two of you share this kind of information with one another?
Well, to be honest, I would argue that our database is better, and the reason is because, one, we have whole genome sequencing, which is what's so cool and new, and the second big thing is we have an incredible amount of diversity within our database. In the UK Biobank, it's primarily European ancestry, which is wonderful, but then you're going to miss a lot of important things. In our database, actually already, we have started to see, for example, in the African American group, why kidney disease is happening more frequently. We're able to actually parse that out because we have so much ethnic diversity here in the United States. So ours is actually, in my opinion, better.
Yeah, I know that some critics have called programs like this scientifically interesting but operationally messy. How are you protecting the identities and health records of everybody coming forward to take part in this?
So everyone who's a part of this is what's called de-identified, which means we take away anything where we can identify the human being, and we only keep things like a number associated with that person. So, for example, patient 1, patient 2, patient 3. But we have all of the medical data for that person. Furthermore, if a researcher wants access to this, you can't just download the data and put it on your database. It's in the cloud, and a researcher has to go through very special, specific things developed by the NIH to even get access. So we are protecting our patients' data very closely that way.
Dr. Anahita Dua, thank you so much for your time and shedding some light onto this database. It's really interesting, and please keep us posted as it continues to grow.
Thank you.
We'll talk to you again soon.